So Hive is actually short for Health in the Virtual Environment. So it is a 24-hour continuous remote monitoring service that was implemented during the COVID-19 pandemic back in 2020. So patients are monitored by skilled clinicians and experts. And what I mean by skilled clinicians or experts, our teams is made up of a multidisciplinary team of clinical nurses and also a consultant. The consultants tend to have clinical backgrounds in emergency medicine, intensive care, and also general medicine. So those clinical experts are actually supported by an AI platform that allows clinicians to detect early signs of clinical deterioration and respond appropriately with those bedside teams. Just so you know, you can see a couple of pictures of what Hive looks like, but it's really made up of 4 key components to deliver the service. So there's real-time patient monitoring. So patients are in a fixed bed space where you have bedside monitors which collect data, which allows you to constantly see waveforms and monitor those patients remotely. We also have an electronic charting platform as well, which we call ISA. And ISA collects and stores the data and the observations that are generated by the bedside monitors, and also any observations that are entered manually by the bedside clinicians. It also has a clinical platform, and that's called eCare. And what this clinical platform does is it pulls the data from all of the WA applications and the information that's stored in ISA together with the clinicians, and it actually then creates predictive alerts, which then allows the clinicians to use those alerts and predictive scores to detect early deterioration and then respond appropriately with those bedside teams. It also has an audio-visual communication system, which allows the Hive clinicians to talk directly to the patients in their beds and also the bedside clinicians. So it's a bit of a summary about what the service, how the service works. And you can see some pictures. The bottom left-hand one is clinicians up on level 11 at Royal Perth, and also at the bedside what it looks like from a patient's perspective using the audio-visual communication. So despite the fact that we've been using Hive since 2020, we have lots of anecdotal data around patients really like it, but we haven't actually done any formal research about what their perceptions are. So this is really what the research is focusing on at the moment, to really get an idea of how patients feel about being enrolled and monitored via Hive. So it's a pretty simple question. What are the experiences of the patients who receive Hive care? What we're really interested in is what the physiological and emotional responses are to being remotely monitored, if there's any perceived loss of independence, if they feel like their privacy is being invaded, what they generally think about the quality and the effectiveness of the service, and their overall satisfaction and perception of the care that they receive while they're actually being monitored by the Hive service. So the study design is it's a qualitative mixed methods descriptive study, and we'll be using questionnaires and semi-formal interviews to collect the data. So we're hopeful the questionnaires will allow us to collect a broad range of data from many participants, and then the semi-structured interviews will allow us to then get that more in-depth knowledge about how they feel about the service. Patient selection. Currently, when patients are enrolled in the Hive service, their consent is gained at the time that we admit them to the service. And part of that is they're asked would they be happy to be followed up post-discharge and provide some feedback about the service. So this is where the patients will be selected from. So anyone that's indicated within the last 12 months post-discharge that they would be happy to be contacted via an email and then a questionnaire. So the questionnaires will be sent out electronically and just managed via RedCap. And at the end of that questionnaire, there'll be a further question as to whether you'll participate in an interview. And then they'll provide basically their phone number and their name, and the interviews will be organised from there. Data analysis, I have to say, hand on heart, not my strong point. Clearly, I'm very fortunate to have some co-investigators that are going to provide a lot of support and guidance in this space, and I just feel like I would really like to call them out now. So I'm lucky to have Associate Professor Vicky Patton and her colleague Carl Yule from the Acute Care Research Unit at Royal Perth, and also John O'Bircham, who's the clinical nurse consultant with Community and Virtual Care, and also Kevin Trentino, who's our research manager, who'll be providing lots of support and guidance in that space. So thank you in advance. But essentially it'll be a thematic analysis. The interviews will be transcribed and questionnaires will be analysed. Summary statistics and relationships between those variable groups is what will be reported. In conclusion, the results will be reported collectively. The qualitative data will definitely provide a deeper understanding of the quantitative data that we collect. And we're hoping it will give us a very valuable understanding of the patient experiences. So we're really hoping that putting the patient at the centre of future design that will be aided by this research. So how Hive evolves in the future, particularly into wearable technology, or how the new iteration of what fixed-based Hive is, the information that we get from this will help us make a more patient-centred approach to remote monitoring. And that's certainly applicable when we move into the community with possibly wearables and remote monitoring within the community, putting the patient at the centre and helping us design that.